let's preface my remarks today by asking that you convey to your wingman, Senator John McCain, our colleague, our warmest best wishes and our hope that he is on his way to a speedy recovery and will be back here because we need him and we need his wisdom. I want to thank Tim Kaine for the leadership that he and Senator Shaheen are showing and an effort to try to help us stabilize the marketplaces. I believe in, we were with Senator Hassan over the weekend. We talked a lot about this, but what do we do now? I think this is an opportunity. This is an opportunity here. And I realize there's a fair amount of confusion as to which path to take or which way to go. And I just hope that we don't waste this opportunity. And I sent a message to the new chairman of the National Governors Association, to the new vice chairman of the National Governors Association. Brian Sandoval is from Nevada, he's the new chair. He's the the governor from Nevada, previously the vice chair. And Steve Bullock from Montana is the new vice chair. One's a Republican, the other's a Democrat. But I sent them a message this morning saying that it'd really be good to hear from the governors. And they've been working on a bipartisan letter. They've been working on it for a while. And this is really the time that it can I think, make a real positive impact. We have 3 people, literally sitting here, 4 of us, literally lined up, who used to be part of the National Governors Association. I loved it, and I'm sure that Senator Shaheen, Senator Kaine, and Senator Hassan did as well. But here's what I suggested that the governors may want to consider in their message. Number 1, urge us to hit the pause button. Hit the pause button. Let's just stop in place for a moment and pivot soon, like not in September, not in August, but like now, like this week, pivot to stabilizing the exchanges. Number 3, return to regular order. Senator Kaine has already mentioned this. When I talked with Senator McCain last week, a couple of times briefly, we both talked about the need for regular order. People have good ideas on health care, introduce them. Committees of jurisdiction, hold hearings. Witnesses, including governors, come before the committees of jurisdiction, a couple of committees in the House, a couple of committees in the Senate, and let's hear from the experts, and let's certainly hear from the governors who have to run these Medicaid programs and have a lot of expertise in this area to offer us. And then I would say after the August recess, if we can actually do something real in stabilizing the exchanges, what a confidence builder that would be among us, and I think around the country. It would be just a great confidence builder. The other thing I would mention that when we come back after the August recess, don't just kind of muck around and wonder what we're going to do. We should pull together in a bipartisan way, something that we talked a lot about doing, we don't often do it, but to really do maybe a couple things. Say, let's figure out what we need to fix in the Affordable Care Act. Republicans believe that Democrats feel it's perfect and nothing should be changed. Well, I don't feel that way, and my guess is that most of our Democrats don't either. Anything that I've ever worked, every bill I've ever worked on was not perfect. And it can always be done better. And the same is true with big programs like Medicare, Social Security, veterans programs, civil rights. They can all be done better. And this is certainly the case as well. Let's fix the parts of the ACA that need to be fixed. Let's preserve the parts that ought to be preserved. And I would say again, to reiterate it, speaking on behalf of some recovering governors, including me, the governors need to be involved in this, heavily involved in this. And I suspect that each of the governors, former governors on the floor here with me today, when we were part of the NGA, we were not here on this floor. Actually, I was on this floor any number of times because governors had access to the floor. But we had many opportunities, many invitations to testify before Senate committees, House committees, on any wide range of issues. And I think we brought value, and we need to hear from them today. I'm going to go back and talk about how do we go about stabilizing exchanges. The first thing that would help would for the administration to stop destabilizing them. That would be a big help. And Senator Kaine has led on legislation that's, and he's mentioned, I want to drill down on just a little bit, that would provide reinsurance, much as we do in other ways in terms of Medicare Part D drug program. But use reinsurance as a very common tool, but use it to help stabilize the exchanges. How would we use in our proposal? Say if this lady standing right in front of me were getting health care, and she was expensive in her health care needs, Under our reinsurance plan, starting in 2018, 2019, 2020, first $50,000 in health care that she used in year one, 2018, the federal government, well, the insurance companies themselves actually would be on the hook for the first $50,000 of care that she would get. Between $50,000 and $500,000, under our proposal, the federal government would pay for 80% of that cost. 80% of that cost, between $50,000 and $500,000, would be on the federal government. Anything above $500,000 would be back on the insurance company. And that's what we do for the next 3 years. Starting in 2021, going forward, it would be the first $100,000 would be on the insurance company for the cost borne created by an individual. Between $100,000 and $500,000, 80% of that would be on the federal government, and after that, it's back again on the rest of it is on the insurance company to pay for. That is his proposal. That's our proposal, and we got a bunch of co-sponsors on it, and we need some Republican co-sponsors as well. It's not a Democratic idea. It's not a Republican idea. It's just a good idea, and it's one that deserves bipartisan support. The second thing that we ought to do to stabilize the exchanges is what Senator Shaheen has proposed. And that is, we have these CSRs, cost-sharing reductions, and I think of them as subsidies to help subsidize for people whose income is under a certain level. I think it's 250% of poverty. For folks that are in the exchanges, getting health care coverage, their income is under 250% of poverty, they currently receive some subsidies to help reduce the cost of their co-pays and their deductibles. And it's not really clear whether that's authorized. It's not really clear whether that's being funded, but it's just been done for a number of years. And the current administration has been saying, well, we don't know if we're going to continue to do that. And there's some folks that want to go to, maybe some states that want to go to court and say, you can't do that. Well, we need to pass a law and say, we're going to have these cost-sharing reductions, and these subsidies will continue to be offered. The last thing, third thing that we need to do is to make clear that the individual mandate, or something as good as, at least as effective as the individual mandate, is going to be around. You know, for the administration to say, well, we don't know if we're even going to enforce the individual mandate. It just encourages young, healthy people not to get coverage. And we got to make it clear that that coverage is the individual mandate, or something as good as. It could be a proxy for, or maybe several things that work together that could be as effective as the individual mandate. And if they don't work, maybe we could just have the default position would be the individual mandate again. But we ought to have hearings on this kind of thing and discuss it and hear from all kinds of folks. The other thing I want to mention is just when I go around my state, my Lord, I've never heard people so interested in encouraging us. I think I'm regarded in my state, along with Senator Coons and our Congresswoman Lisa Blunt Rogers, I think we're regarded as bipartisan people. We're Democrats. We're proud to be Democrats. We like to work with Republicans, too. And I think that's part of being a recovering governor. But the people in my state don't want on this subject, on health care reform going forward, they don't want a Democratic victory. They don't want a Republican victory. Frankly, they don't want a Trump victory. They want a victory for our country. That's what they want. They want a victory for our country. And you know what? So do I. And I think so do most Democrats in this chamber and most of the Republicans. And so let me just again, if I could make the suggestion, let's hit the pause button. Let's stop in place for right now. Let's pivot and figure out how we can stabilize the exchanges. I've laid out several ways to do that. Let's return to regular order. Hold hearings, bipartisan hearings. Have expert witnesses, including folks from all walks of life who know a lot about health care coverage, know a lot about health care. After the August recess, when we come back here, let's launch a real bipartisan effort to fix the things in the ACA that need to be fixed and preserve those aspects that should be retained. And as I said before, we need governors at the table, not just recovering governors. We need governors at the table, and a bunch of other folks as well who have a lot to contribute. And if we do those things, we will, in the words of, I'm going to paraphrase Mark Twain. Mark Twain used to say, when in doubt, tell the truth. You'll confound your enemies and delight your friends. I think that's what he used to say. In this case, I would just say, Paraphrasing Mark Twain, when in doubt, do what's right. When in doubt, do what's right. We'll confound our enemies and delight our friends.